And government has vaccinated over 83,000 health workers, exhausting the first batch of the Johnson & Johnson vaccine. In Gauteng, it's relying on private-public partnerships to accelerate its vaccine rollout program. The Milpark Hospital in Johannesburg began its vaccination program this week. The provincial government is targeting over 200,000 health workers. eNCA's Manqoba Mchunu is there at Milpark with the latest for us with that update. And Manqoba, this is an important leg of the story, is it not? Because many of us, when we think healthcare workers, you immediately think, the public sector. But actually, in our country, the private sector is just as important an element of healthcare and healthcare workers there. Just give me a sense of what the start of the vaccine program at Milpark means for vaccination of healthcare workers in the private sector.
Well, certainly, Tula, is quite a significant moment for many of the healthcare workers here. In fact, I have been speaking to some of them who have received this vaccine this morning, and they're quite excited, Tula, but also very relieved. I spoke to one of the sisters earlier on who works in an ICU ward here at Milpark Hospital, and she was quite emotional this morning, saying that, she deals with the COVID-19 patients on a daily basis, and, it saddens her to see some of those patients losing their lives. She's also seen some of her colleagues losing their lives to this particular virus. So she was quite relieved to us this morning that she finally received an injection. And certainly that is a sense among many of the healthcare workers here who have been lining up this morning. We've seen very long queues here at Milpark Hospital of those healthcare workers. And we do understand that already to us, over 420 of them have been inoculated this morning alone. And the hospital saying that they have a daily threshold of 500. So they are about to wrap up right now to us to vaccinate those healthcare workers. But I just want to bring in Jacques Duplessis, who speaks on behalf of Netcare, just to bring us into light with regards to the vaccination program here. Jacques, thank you for your time. Let's start here. The vaccination program starting here at private facilities as well. How has it been?
It's actually been fantastic. We had such great support from National Department of Health and from our local colleagues as well, and from the other private hospitals. There's now 12 private facilities with Netcare Milpark, one of the main centres. We service 4 other hospitals, being Helen Joseph Hospital, Wits Donald Gordon, Netcare Park Lane and Netcare Garden City, and Life Brenthurst. Yesterday we did 400 vaccinations. We were finished by 2:30. Today, as you said, we're now on 450 already. So 70 left, and we probably would be finished by 2 o'clock. Tomorrow we aim for another 500, and provided we get the vaccinations over the weekend, the next batch of 39,000, we are actually aiming to do 1,000 vaccinations. We've got 30 vaccination stations, and we risk stratify all the healthcare workers that are patient-facing first. And my appeal would be to healthcare workers to ensure that only those that are patient-facing do come to the facilities once they get their Sisonke vouchers to be vaccinated. But overall, I am delighted at the cooperation and the work that we've done so far.
Okay, and what are some of the challenges, Jacques, that you have faced in the past 2 days? I do understand that this is the second day of your rollout here at this hospital.
The only hurdles that we've seen is really people arriving at the centre that were not supposed to be here, healthcare workers that are not patient-facing, and not having enough vaccines. That's really the only rate-limiting factor we have.
And in terms of, your program, what are healthcare workers saying at these sites? Are they willing to vaccinate? What sense are you getting from the healthcare workers themselves?
Overall, delightment in having the opportunity. I certainly have not had one single person that were negative. They're all smiles. Our doctors are complimenting, our staff are complimenting the process, and all are majorly excited by being vaccinated. And we look forward to continue this program.
Okay. And in terms of how you're operating here today, take us through the process of what happens when one gets into this facility.
It's quite a process. We start off, as you could see, we're utilizing a parking lot, well ventilated. We start off at our level 6 where you arrive. Obviously, proper COVID screening, temperature taken, and you are then screened. You then move to an admin area where it's certain that you are in fact the healthcare worker that face patients. From there you move through to the electronic vaccination data system where our administrators make sure that you are the right person for the right token, and then you sit in a row to be vaccinated. As I said earlier on, there's 30 vaccinators. You are then vaccinated and you move through to a period of 15-minute observation. The actual vaccination process can take as little as 6 minutes.
Okay. Well, thank you, Jacques, for speaking to us. So that was Jacques du Plessis, who is the General Manager at eNCA, painting a picture to us of how the vaccinations are going on here this morning. And certainly I can see from the sides that queue has really went down. We are seeing quite a number of empty chairs here at this particular facility, but this speaks to the demand and just how many of those healthcare workers here in the private sector have heeded that call to come and vaccinate.
All right, thank you for that. That's eNCA's Manqoba Mchunu at the Milpark Hospital, and with great insights there from the representative of that particular hospital in terms of giving us the figures, right, in terms of the flow of traffic of those healthcare workers getting their inoculations in the private sector, in the various sites where all of this is happening, and hoping that they receive a further supply of the Johnson & Johnson vaccines over the weekend, because they are hoping to actually ramp it up next week, ramp up their vaccination program.